The surge in cases in Georgia is now at the point where the state health department director says there's now widespread transmission across the state.
Joe Hankey explains what that means and why one public health expert says it's a sign the state needs to bring back some of the restrictions it lifted.
As Dr. Kathleen Toomey said, Georgia is in a state of community spread today. She added cases are increasing in the urban Atlanta area, the suburbs, and also Georgia's rural communities. It's the same place Dr. Toomey said Georgia was in more than 3 months ago during a press conference when Governor Brian Kemp issued the state's stay-at-home order. The first 2 reported cases of COVID-19 in Georgia, state health officials linked to travel abroad, with the father coming home from a business trip to, at the time, a coronavirus hotspot, Milan, Italy. And then his son also became infected. The virus then began to show up in many parts of Georgia, with people being infected from unknown sources as the virus spread. Here is Dr. Kathleen Toomey during an April 1st press conference.
From what was related to travel has now become, in many parts of our state, widespread community transmission.
Community spread or transmission is defined as infections identified in a given geographic area without a history of travel elsewhere or no known connection to a known case, according to the Kaiser Family Foundation, meaning you catch the virus but can't identify how you became sick. Now, weeks after the state reopened, Toomey this morning announced Georgia is again in a state of community spread.
Our test positivity rate on average is 13.6%, which reflects community spread.
What that means is that there is high risk for anyone who is out in public spaces.
Dr. Harry Hyman is with Georgia State University's School of Public Health.
We opened much too quickly. We don't have a containment strategy in place, and the virus is spreading pretty rampantly.
And with community spread taking place, Hyman says there's only one way to react.
Walk back our reopening in meaningful ways, including mandating masks, closing down indoor dining in restaurants, not allowing people to go to amusement parks, in services in churches, all of those things that we know are going to add to the rapidly surging number of cases, hospitalizations, and increasing death rate.
Another critical piece of slowing the surge in cases here in Georgia is contact tracing, but it depends on the quick turnaround of test results. We're going to walk you through what the state is doing to step up those efforts coming up in the next half hour. In the meantime, though, if you had tested positive, we'd love to hear your experience with contact tracing. You can call us and leave us a message at 678-765-9514. Make sure to include your name and number, and we may use part of your message in our coverage online and on air.